Your heart is dying. Death due to heart diseases is the first cause of death all over the world. However, most heart diseases are caused by preventable and modifiable factors. Let's take a look at harmful behaviors that can cause heart disease. 1. Using cigarettes and tobacco products. The chemicals in tobacco damage the heart and blood vessels. Cigarette smoke reduces oxygen in the blood. The heart works harder to send enough oxygen to the body and brain. The result is an increase in blood pressure and heart rate. Exposure to secondhand smoke has similar effects. The best thing you can do for your heart is to quit smoking and stay away from secondhand smoke. Once you quit smoking, your risk of heart disease begins to decrease immediately. After 1 year, your risk of heart disease is halved compared to a smoker. 2. Living sedentary, not exercising. Being active and exercising regularly is an excellent way to prevent heart diseases. Exercising regularly protects against heart diseases, as well as diabetes, stroke, some types of cancer, and high blood pressure. Regular exercise also helps control stress, boost mood, control weight, and get better quality sleep. Regular exercise means at least 30 minutes of activity, 5 days a week. There is no need to even go to the gym for this. A brisk 30-minute walk outdoors does the same job. A sedentary life paves the way for many chronic diseases, as well as heart diseases. Studies have shown that the risk of premature death is higher in people who constantly sit and watch television and who constantly ride in the car. 3. Not being at a healthy weight. Excessive weight and increased waist circumference can cause many diseases, including heart diseases. Studies show that as body mass index increases, the risk of heart disease also increases. Apart from heart disease, being overweight can cause diabetes, gallstones, sleep apnea, some types of cancer, high blood pressure, infertility, and joint diseases. As people get older, their weight gain increases. In addition, today's people's fast eating habits and low activity make it easier to gain weight. Factors such as industrialization and easy access to food have caused the number of overweight people to increase over the years. With the development of technology, people can do many jobs without spending much energy. Due to the changing lifestyle, ready-made food consumption has also increased. It is well known that packaged convenience foods contain higher levels of salt, sugar, saturated fatty acids, trans fats, and processed carbohydrates. Excessive consumption of ready-made foods causes consumers' body mass index to rise rapidly. 3. Not being at a healthy weight. Due to the intensity of working life and the influence of advertisements, people are increasingly turning to ready-made food. As we mentioned above, ready-made foods contain too much salt, processed sugar, and unhealthy fats. Irregular and unhealthy eating makes it easier to gain weight, cholesterol increases, the risk of diabetes increases, and blood pressure increases. All of these increase the risk of heart disease. In a healthy diet, the following foods should be consumed regularly and balanced. Fresh fruits, vegetables, beans and other legumes, enough lean meat and fish, lean poultry, whole grain products, reduced fat milk and dairy products, olive oil, and nuts. Another rule of healthy eating is to get enough fiber from the diet. Getting enough fiber in the diet prevents overeating, prevents constipation, and helps control cholesterol. Water is indispensable for the continuation of life. Drinking enough water is important in a healthy diet. It is necessary to stay away from sugary and carbonated drinks. 5. Not getting enough and quality sleep. If you don't get enough sleep, you won't just be tired, your health will suffer too. Studies have shown that obesity, heart attack, high blood pressure, diabetes, and heart attack are more common in people who do not sleep enough. An adult person needs at least 7 to 8 hours of sleep a day. For a quality sleep, you should regulate your bedtime and wake-up times. If you suffer from insomnia, it may be beneficial to watch less television and not use technological devices in the evening. It is beneficial not to eat late, take a warm shower, and listen to relaxing music. It is important to adjust room temperature and light. If you are tired, even if you sleep for enough time, you may have sleep apnea. People with sleep apnea snore extremely loudly, and their breathing may be interrupted for short periods of time, several times a night. In this case, you should get help from a physician. Losing weight and using breathing aids such as CPAP may help. 6. Not controlling blood pressure. There is a close relationship between high blood pressure and heart diseases. Even healthy people need to have their blood pressure checked at least twice a year. The following conditions are often accompanied by high blood pressure. To smoke, being overweight, to be still, a diet rich in salt and sugar, consuming excessive alcohol, extreme stress, having diabetes. High blood pressure can be treated with medication, and you can keep your blood pressure within normal limits by making changes to your lifestyle. 7. Not keeping high cholesterol under control. If blood cholesterol is high, plaques form that block the arteries. This increases the risk of coronary artery disease and heart attack. Triglycerides are another type of fat found in the blood. Increased blood triglyceride levels also increase the risk of heart disease. Situations that increase cholesterol include a sedentary lifestyle, being overweight, eating a diet rich in cholesterol, and being diabetic. You can keep your cholesterol under control with changes in your lifestyle along with medications. 8. Having an extremely stressful life. Studies have shown that there is a relationship between excessive stress and heart diseases. It is even thought that excessive stress can trigger a heart attack. Some behaviors caused by excessive stress also increase the risk of heart disease. These are smoking, overeating, consuming too much alcohol, lack of activity, unhealthy diet, and being overweight. Stress, irregular heart rhythm and heart rate. Increase in blood pressure, decreased blood flow to the heart. It may cause the inflammatory process to start in the body. Controlling stress reduces the risk of heart disease and stroke. 9. Drinking too much alcohol. Drinking too much alcohol can raise blood pressure. Additionally, since alcohol contains sugar, it means taking in extra calories. This situation paves the way for being overweight. Normally, it is recommended for men to consume 2 glasses of alcohol a day and for women to consume 1 glass of alcohol. 10. Uncontrolled diabetes. Diabetic heart disease is twice as common in diabetic patients. Coronary heart disease, heart failure, and diabetic cardiomyopathy are seen in patients with diabetes. If you smoke, are overweight, have high cholesterol, high blood pressure, and have heart disease in your family, your risk of developing heart disease is higher. Quitting smoking, keeping diabetes under control, losing weight, keeping blood pressure at normal levels, lowering cholesterol, and exercising regularly significantly reduce the risk of heart disease. Even if you think you are healthy, it would be appropriate to have your blood sugar checked a few times a year. If you have a familial predisposition to diabetes, it will be beneficial not to gain weight and consume less carbohydrates. Apply to the nearest health institution to learn about your risk of heart disease and to have the necessary checkups. We wish you healthy days.